We're gonna go over some composite restorative stuff. And this is our patient. And as you can see, we've practiced bonding. And we've got our whole setup over here for the suction, the high speed, the two-way air syringe. And we're going to be working on the lower. And y'all took these home last time. Did you practice?
Yes.
Yes. How was it?
My daughter figured out which way was front and back because if not, it won't go in.
Yeah.
So the little piece on the bottom has to be touching you.
Yes. So as you can see, there's one side that's longer, and that's the part that goes in to hold the cheek, and then this part kind of keeps it from popping up. Okay. And of course, real lips work a lot better than the plastic, but that's okay. All right, so we've cleaned the teeth, we've profied, okay? We've isolated it. We saw a picture of this on the dental assisting guide. So here is your dry angle, looks like a triangle, and it's cardboard on both sides. And of course it goes in like the greater than, less than, it goes in just like the shape of the crocodile mouth. So I'm gonna put that in there, small part towards the back on each side, just like that. Okay, now what's the rule about cotton in the mouth?
You saturate it before it.
Saturate, saturate, saturate before taking it out. So if this is my water, I'm gonna saturate it. Not just rinse it a little bit, but I mean hold that suction and saturate it, okay? So initially when we're working on a patient, like even if we were doing the sealants and the, well, we'll just stick with sealants like we were the day of the dental clinic. You have all of your stuff. You have your etch. And this one is 37% phosphoric acid. But of course, you're not going to tell your patient, we're going to put acid on your teeth, because a mom's going to be like, wait, what? What do we call this?
Soap. At least at my house, they call it the soap.
They call soap?
Yeah.
Okay, well, that's now considered child abuse.
Oh.
Putting soap in a kid's mouth because a kid died from that.
They call it special soap.
Special soap?
Yeah.
So I tell a kid, this is a special cleaning solution, or a special toothpaste that really cleans the teeth, okay? So let's do your social 6 is canine to canine on the upper. So we'll do the lower 6. We'll do canine to canine. So if I was doing a bracket, I would only etch where that bracket's gonna go. I'm not gonna cover the entire tooth. Okay, now if I'm doing a lumineer or a veneer or something like that, I'm going to cover the whole tooth. Okay, just like that. So we're going to do canine to canine. And how long do you leave etch on the teeth? Huh? Did you say 3 months?
3 minutes.
No.
30 seconds.
Typically 30 seconds.
Oh, yes.
But always read the manufacturer's instructions, okay? So we would check for that. And I left a canine out here while I was talking, so y'all should have picked up on that. Shame on you.
I can't see from the same. Yeah.
So if we're doing canine to canine, how many teeth is that?
A lot.
Canine to
6.
canine. 6 teeth, okay? So when I'm doing the etch, I'm not just gonna push it and go because it'll keep oozing out. Pull back on it. You know, you've watched ER. You've seen them do stuff like that. And set it aside. And then let's say it's been 30 seconds. And we're going to turn our machine on. Huh? Oh. Can you go grab me a cup, sweetie? All right. Now, there's another type of etch. This is a gel etch. You also have liquid etch. And so if you have liquid etch, you would want a cotton pellet like we saw in the dental assisting guide. And typically it's like a neon yellow green color. And you would put it in one of your little dapping dishes and then take your pickups, put it in there, pick up the cotton pellet, and then just dab the tooth. I don't like that. You don't have as much control and it just kind of oozes everywhere. And the thing about etch is it's really bitter. Like it's very sour tasting. And so if you've ever had like a Sour Patch Kid or something, it really gets those salivary glands going. And you're trying to keep a mouth dry. So what we want to do is suction the etch off. And I can feel that suctioning. And so you want to try to suction with like the HVE, high volume evacuator, and put this back here and suction it up. And where you're going to hold it is right behind the second molars. You don't want to go straight back where the uvula and soft palate is because you're going to gag them. So rinse the teeth off, catch it before they swallow it, okay?
It's under the tongue.
Huh?
And it's under the tongue. Between the tongue and the...
No, behind the second molar.
Oh.
That's called the retromolar area. So we're gonna put your suction back there. And then once you're done, dry it. I also like to get the water off of the retractor. And then the teeth are gonna look chalky white, okay? All right, so now you have these completely stripped of oils and stain enamel. It's completely naked, there's nothing on it. It's completely a blank canvas for you. If the patient coughs or breathes out of their mouth like, all that hot, moist breath is going to make these damp. And the glue is not going to stick to water. So moisture is our enemy, okay? So you want to make sure you dry it off. And sometimes some assistants will just keep that light flow going just to keep the moisture going, or they'll have the suction going the whole time, okay? But when I was an orthodontic assistant, if I had one bracket come off, I would put these in and a little bite block and use the suction, just put that back on and go, okay? But when you're doing something like a lumineer, veneer, it's gotta be dry, okay? All right, so now that we have the enamel exposed, the enamel rods are there, they're in the shape of a keyhole, so it's like all these holes are exposed. And then now we're gonna fill it with primer. So here is your primer. And you have brushes, just like if I were gonna paint my nails. This gets painted on the tooth, all right? Here's what I don't like to see. I don't like to see a big old glop like that. And then it just glops on the tooth. Just like you don't want to glop it on because it looks bad when you glop on your nail polish, this goes in a little dapping dish like this. And then you're going to mix it up a little bit and paint it on the teeth, okay? Just a thin coat, all 6 teeth, okay? Now, if it's light cured, then you need to take the light and cure it. There should be a blue light right there behind you. Okay, so you don't want to look at the light. Oh, it's low, sorry. All right, never mind.
Yeah, it's not plugged in.
Oh, sorry. All right, so you would put the light on it, and you've seen the blue light before when y'all were doing the sealants. But the main thing is, like, even if we're doing the sealants on the occlusal surface, where are you going to etch?
On
The grooves.
In the grooves, the pits and fissures, where the sealant's going to go, where the etch is going to go. And so you're going to etch right at the pits and fissures. You're going to suction, rinse, dry, put the sealant on after all of that is dry, and then put the sealant composite on there. So we have put the primer on, or sealant, and then this is your flowable composite. And we have specific ones that say sealant. So this is your A2, A3, A3.5, B2. So we're going to take this out. See if one of those other lights are charged up for me.
So what's the difference with the numbers?
Okay, so the difference with the numbers is, are your teeth white? Yes. If I brought a 60-year-old man who's never bleached his teeth, who's smoked 3 packs of cigarette a day, is he going to have white teeth?
Probably not.
Probably not. So he's going to be a darker shade than you. Okay? Just like tanning. I'm going to go tan for 5 minutes and just get a pre-wedding glow. Or I want to look like I've been in the Hawaiian tropics, and I'm going to go for 20 minutes. Okay? There's different shades. So for this, you have the different shades, and there's a shade guide that you can actually put up to the teeth and match it up. Do you remember that Pepsi commercial with Britney Spears and how white her teeth were? Well, that started a whole new thing in dental offices called Britney Spears white. Okay, it's bleach white, like she's got the prettiest teeth. So here is the flowable composite, and I'll push it and look how runny it is. Now, is it the same color as these teeth?
No.
No. What's the difference?
It's darker.
It's darker.
brown.
All right. So let's pick a different color. Let's see, that was A2. Let's do A3, see what that looks like.
Right there next to your hand. No.
Even darker? Mm-hmm. So it just depends on, the patient. Let's see what B2 looks like. Let me get a new one.
Yeah, for a moment I believed you.
What?
I thought you really didn't know which one it was. Just for the quickest moment until I realized.
Is that more opaque looking?
Mm-hmm. It's definitely not as dark.
Mm-hmm. It's more like a buttery yellow. So when we have patients that come in, let's say one of their teeth was a peg lateral, a skinny little lateral. You know what a peg is, right? Like a peg leg, Captain Hook, where he's got the skinny leg. A peg lateral is shaped like that. So if it's too skinny, but we take braces and make room, and we add bonding on either side, we're going to have to etch, rinse, dry, seal, and then add that bonding to it. And so when we do that, we got to match up the color, and we've got to have the instruments to do it. So hand me that 2x2 behind you, sweetie. So we're not going to light this up, but I just wanted to show y'all. If we were going to do that, we'd light it up, and that flowable composite would get really hard, okay? So those are pretty much the steps in bonding. They pretty much never change. Etch, rinse, dry, seal. Sometimes you'll use like a booster to that has a little bit of alcohol in it. If there was any type of moisture, it would, make it even drier. Sometimes people use a hair dryer looking thing called a tooth dryer, and they'll dry it and then put the primer on. But the main thing is, tell the patient breathe through your nose, not through their mouth. If they're having allergies, set them up a little bit. You might have to do some stand-up dentistry. That's okay. But those are the basic steps in bonding.